So here we have a brain tumor case, in the preoperative scenario. This is a high-grade glioma in the left temporal lobe, as you can see here. We have the 4 inputs to NeuroQuant Brain Tumor as shown here. So we have our T2, we have our flare here, as well as our T1 pre-contrast, and then our T1 post-contrast here. And you can see that this has necrotic core, as well as some enhancing components in addition to surrounding flare hyperintensity, which these components are the main labels that are outputted in NeuroQuant Brain Tumor. Now, for these inputs, we follow a protocol that is similar to the BTIP protocol, and we accept for the T1s, or the T1 pre or the T1 post to be, we'd like those to be 3D. Typically the T1 post is always 3D, and the T1 can be either 3D or 2D. And then for the flare and T2, those we can be minimum of 2D, but 3D is always preferred. And sometimes some sites would prefer to send a 3D flare sagittal acquisition. So here you can see the segmentation output report to NeuroQuant Brain Tumor. So we have 3 main sections here. We have the patient information, anonymized in this case, patient ID, sex, date of birth, and referring physician, as well as the scan acquisition date, and then the date that this report was generated, as well as some software versioning and the AI model version that has been used in this run. And finally, the site information. Here it says Cortex, but if you're using this at your site, it would have your site information for posterity's sake. The second section is the tumor visualization. So this shows just some snapshots of the center of mass of the tumor of the 4 inputs that I was showing. So T1 pre, T1 post, T2, and flare, as well as some slices of the axial segmentation of the tumor, as well as a sagittal view of that same segmentation. Down below, really the meat of the product is showing the different regions. So we can see here there's up to 4 different regions or classes that NeuroQuant Brain Tumor produces, and the enhancing tissue in red, the necrotic core in green, the surrounding flare, non-enhancing hyperintensity, as well as a resection cavity, which is applicable in postoperative cases. So here you can see the enhancing tissue, just have a color code for visual linking purposes, that has a 7.5 cubic centimeters in volume as predicted by the output of the model. Now, the whole lesion itself will be considered the enhancing plus the necrotic core plus the flare, and that has a volume here as shown as 83.45 cubic centimeters. Given the use case of NeuroQuant Brain Tumor is maximized for longitudinal processing, here I wanted to show you a follow-up case from the previous preoperative scenario, high-grade glioma in the left temporal lobe that we were looking at. And now we are 3 months post-op. So you can see the post-op report has an extra section looking at the longitudinal tracking with the same patient information above, some tumor visualization screenshots just to orient where the tumor is and showing the center of mass of that tumor with the axial segmentation. Note here, the resection cavity is highlighted in blue to indicate that this is detecting that it is a post-operative case, as well as with the enhancing rim here. Now we have this longitudinal tracking section, which is showcasing the enhancing tissue area, enhancing tissue volume, and the whole lesion volume. And you can see now for time point 2, we have less enhancing tissue as recorded by our app, as well as less whole lesion volume. This is powerful when the patient continues to follow up if they have other therapies such as radiotherapy or chemotherapeutics, and being able to track the volume over time is valuable here. Below, you'll see the quantitative measures as shown before with the different regions, enhancing and whole lesion, and then showcasing the prior and the current volumes and the % change between those 2 time points.